I chose to do the disease of acne vulgaris. It typically affects areas of the face, upper chest, and back. These are areas with the densest population of sebaceous follicles. There are several factors that cause acne, which will be discussed later. However, there is a certain microbe that can also contribute to this disease. Propionibacterium acnes, or P. acnes. It is pleomorphic, meaning that it has a variable shape and size in response to the changing environment conditions. P. acnes is sometimes branching bacilli, meaning it is rod-shaped. It prefers anaerobic growth conditions, so conditions with no oxygen. This bacteria is also gram-positive, meaning it has a cell wall composed of peptidoglycan. P. acnes only triggers the disease when it meets favorable dermatophysiological terrain. P. acnes is the most abundant bacterium on the human skin. It predominates in pilosebaceous follicles of the skin, mainly in the fatty acids of sebum that is produced and secreted by the sebaceous glands. However, P. acnes can also be abundant in dry areas as well. This is a diagram of the progression of acne. This is how it worsens around an infected pore. Going left to right, top to bottom, in the first picture, P. acnes can be found even in normal pores. Sebum produced in sebaceous glands is excreted from pores up to the surface of the skin. In the next picture, if normal characterization occurs near the exit of a pore, the pore becomes blocked, trapping sebum inside. This can be referred to as a comedo. The third picture shows when sebum builds up. P. acnes, which live on fatty acids in the sebum, begin to increase. P. acnes produces a variety of substances that cause inflammation, resulting in reddish inflammation as papules. Starting at the picture on the bottom left, as the inflammation advances, the wall of the widened pore breaks, causing the inflammation to spread and pus to exude. Next, popping pimples or having your hair constantly rub against your face irritates the acne, causing it to worsen further. And finally, if acne gets worse, it may leave scars after it has healed. Secretions. P. acnes secretes several pro-inflammatory products, which can play an important role in the development of acne inflammation. These products include lipases, proteases, hyaluronases, and chemotactic factors. The immune response to P. acnes includes humoral and cell-mediated immunity, as well as complement activation. P. acnes releases lipase that produces fatty acids by digesting sebum, thus creating inflammation of the skin. The extracellular lipase hydrolyzes sebum triglycerides to glycerol and free fatty acids. This can contribute to comedone formation. Enzymes produced by P. acnes leads to the rupture of the comedonal wall, the impetus for the large inflammatory lesions. While P. acne is a part of the normal flora of human skin, it can also be found in other areas, such as the oral cavity, large intestine, conjunctiva, and the external ear canal. The genome of it has been sequenced, and a study has shown that there are several genes that can generate enzymes for degrading skin and proteins that may be immunogenic, meaning that they can provoke an immune response in the human body. As said earlier in the slides, humoral and cell-mediated, as well as complement activation. P. acnes is an opportunistic pathogen involved in the development of diverse medical conditions. but it's also a proven contaminant of human clinical samples and surgical wounds. It has been isolated from patients with endocarditis, which is an infection of the endocardium, the inner lining of your heart chambers and heart valves, synovitis, which is inflammation of the joints, acne, pustulosis, which are thick yellow blisters containing pus, often in the palms and soles, hyperostosis, the inflammation in bone substance, and osteitis, the inflammation of the bones, also known as SAPHO syndrome. And sarcoidosis, which is an inflammatory disease that affects multiple organs in the body, but mostly the lungs and lymph glands. Abnormal masses or nodules consisting of inflamed tissues form in certain organs of the body. Acne vulgaris is the formation of comedones, papules, pustules, nodules, and or cysts as a result of an obstruction and inflammation of pilosebaceous units, hair follicles, and their accompanying sebaceous gland. Comedones, which is the first stage of acne, are the skin-colored small bumps frequently found on the forehead and chin of those with acne. Open ones are blackheads, black because of the surface pigment, which is melanin, and closed ones are whiteheads. The follicle is completely blocked. They are mostly clogged with oil, dead skin cells, and bacteria. Bacteria like P. acnes tend to thrive in these conditions. Papules is the more advanced stage of acne and are a solid elevation of skin with no visible fluid, bearing an area from a pinhead to 1 centimeter. They can be brown, purple, pink, or red in color and can cluster into a papular rash. Pustules is the more advanced stage of acne. They are small bumps on the skin that contain fluid or pus. They usually appear as white bumps surrounded by red skin. These bumps look very similar to pimples, but they can grow quite big. P. acnes proliferates, pus accumulates, and inflammation worsens. Nodules and cysts is the severe stage of acne. It is the growth of abnormal tissue that is developed just below the skin. They can develop in deeper skin tissues or internal organs. It is the general term to describe any lump underneath the skin that's at least 1 centimeter in size. Acne is one of the most common skin diseases. It affects 80% of the population age 11 to 30, and it affects more than 45 million people in the United States. The main causes of acne are the excess sebum production, the hyperkeratinization, a disease disorder of the cells, of the exit of pores resulting in clogging, and the proliferation of P. acnes bacteria. There are several host factors that contribute to acne vulgaris susceptibility, including genetic factors, stress, the keratinization pattern of the hair follicle, androgen levels, and the use of medications such as steroids or oral contraceptives. Acne can be treated through a number of medications, including benzoyl peroxide and topical antibiotics, which kill or prevent the spread of P. acnes. Topical retinoids reduce inflammation. For moderate acne, treatment plans usually involve oral antibiotics is recommended, providing bactericidal effects and reducing inflammation. Orally administered isotretinoin, also known as Accutane, is the only treatment that leads to complete remission. Problems that occur when treating P. acne is the biofilm formation can limit the access of antibiotics to the site of the infection. In addition to biofilm formation, virulence of P. acnes, which refers to a pathogen's ability to infect a resistant host, is enhanced by a number of factors contributing to the adherence and persistence of colonization. And that is my presentation over Acne vulgaris.